to the next one is the nausea and the vomiting. Vomiting is caused by the noxious stimulus of the vomiting center directly or indirectly via. There are four sites which cause the vomiting directed by the vomiting center. The vomiting is caused by stimulation of the noxious stimulation of the vomiting center directly or indirectly by four characters. It's in that one of them is the gastrointestinal tract, and the gastrointestinal tract, once the receptors are activated in the gastrointestinal tract due to the due to the mechanism, like um, in this disease we get the the H pylori infections, everything, and due to this there is some unwanted thing happening in the stomach. To compensate this, our stomach creates a mechanism to expel all these contents, and this mechanism we get vomiting. And before vomiting, the vomiting sensation is nothing but nausea. And because of the stimulation, um, the receptors in the GIT are activated, and the neuronal pathways lead to the vomiting center. The neuronal pathways are that travel along or the afferent fibers of the cranial nerves, that is the ninth cranial nerve, that is the glossopharyngeal nerve, and the 10th nerve, that is the vagal nerve. They take the efferent response from the GIT to that of the vomiting center. Okay, and next coming to hematemesis. What is hematemesis? Hematemesis indicates the bleeding from the hematemesis is the blood in the vomiting. Hematemesis is nothing but the blood in the vomit. How it is mainly caused? The hematemesis indicates that the bleeding is from the upper gastrointestinal tract, usually from the esophagus, stomach, or proximal duodenum. If the if the vomited blood is brown and granular, that is coffee grounds color, then it is because it has been digested by the stomach acids, due to which the hemoglobin has been converted to acid hematin, and which imparting it the characteristic of the brownish color. And if the blood in the vomit is a bright red in color, then it has been directly excluded from the esophagus, or if it came from the stomach or duodenum. duodenum, then that was not retained within the stomach long enough, retained in the stomach long enough to cause its digestion and thus alteration of the color, and so the color will be in red in color. Okay, and as this is the general thing that happens, as H. pylori causes ulcers. Not only H. pylori, what are the other mechanisms by which ulcers are produced? If ulcers are being produced, the bleeding occurs. As we already discussed, some unwanted thing is happening in the stomach, our body creates a compensate mechanism to expel the vomiting, expel the contents, and so the MC is being occurred. And the next symptom is the weight loss or the weight gain. Okay, because of because as eating causes pain, many patients with the gastric ulcers avoid meals and consequently lose weight. The duodenal pain may be relieved by the food, and so the patients with duodenal ulcer may have a weight gain. And the mechanism in which the duodenal pain is being decreased is not clearly understood. And as we already know, what is a duodenum? Duodenum is the first part of the small intestine, the part of the digestive system that travels straight after it leaves the stomach. Okay, and what is the melena? The next one is melena. Melena is nothing but refers to the black tarry stools, which usually occurs as a result of upper gastrointestinal bleeding. It has a characteristic tarry color and offensive smell. And this is also because of the blood mixed stools. Okay. The progressive dysphagia. What is dysphagia? In dysphagia is nothing but difficulty in swallowing. Because of this H. pylori and all those, there is an inflammation occurring in the esophagus, inflammation of the esophagus, and that results in dysphagia. And final one is iron deficiency anemia. What is this iron deficiency anemia? We need iron to make hemoglobin. If there is a lack of hemoglobin, if there is a lack of iron, then no hemoglobin is being formed, and thus causing no hemoglobin is being formed, and thus causing iron deficiency anemia. Okay. And then um, as this patient, as the peptic ulcer patient, as bleeding is seen in chronically, that is a slow and chronic way, as there is a blood loss within the body, as we need, as a blood loss is in the body is seen, and as the mucosal lining is being damaged, there is no proper absorption of the food. as the no proper absorption of the food, no iron is being absorbed. As no iron is being absorbed, there is no iron for the production of the hemoglobin, and which leads to iron deficiency anemia. Okay, and that's it for signs and symptoms.